The following is a summary of the health plan for the employees of the town of Maplesville for July 1st, 2018 through July 1st, 2019. My name is Barry Hamrick. You can reach me anytime at 205-222-9440 or via my email rbhinsurance@gmail.com. Your new health plan has two parts. First, there's your primary plan through Blue Cross Blue Shield of Alabama, and now you have a new GAP plan or secondary insurance plan that will pay most of your out-of-pocket for major medical expenses. It's important to know how this plan works to be sure it's working for you just as it should. I think you will agree this is an amazing plan, but only if you know exactly how to use it properly. So let's go over the timeline. Step 1, give your healthcare provider both of your new insurance cards, Blue Cross of Alabama and your GAP plan card. Step 2, your healthcare provider files the claim with Blue Cross of Alabama. Step 3, Blue Cross processes the claim. This will generate an EOB, or explanation of benefits. With the traditional plan, this is normally where the healthcare provider would send you a bill. However, with this program, they will now file that EOB along with the original claim to your GAP plan. In turn, your GAP plan pays your healthcare providers directly until your funds have been exhausted. So for most of you, this will eliminate out-of-pocket for major medical claims. So let's take a look at the details. Here you'll see a summary of your health plan coupled with your new GAP plan. You'll note your health plan has a $40 or $65 copayment for an office visit, depending on which kind of physician. Your new GAP plan is designed to pay $25 towards your first 8 office visits each calendar year. That will effectively turn your $40 office visit copay into $15 and a $65 office visit copay into $40. This applies to the first 8 office visits for you or your family during the year. After that, you'll just pay your $40 or $65. The section in yellow represents your out-of-pocket costs for things that are not an office visit but also not a hospital stay. We'll call this your outpatient major medical benefit. Your new GAP plan is going to pay the first $2,500 for you on your behalf for these claims. So take a look at emergency rooms. Normally, you would have a $400 copayment for the emergency room plus a $65 copayment for the emergency room physician. However, now your GAP plan is going to pick that up for you. So if you do not exceed $2,500 for major medical outpatient claims, that's claims that are not an office visit and not a hospital stay, your out-of-pocket will be $0. Just below that section in yellow, you'll find your inpatient major medical benefits. You will notice the deductible applies of $2,600, plus you would pay $390 per day for the first 5 days. The good news here is your GAP plan is going to give you a separate $5,000 benefit for inpatient hospital stays. So if you do the math, you'll notice the GAP plan is going to pay all of your covered hospital expenses, no matter how long that hospital stay is. It's also good to know that since your health plan has 2 times the out-of-pocket maximum for a family, your GAP plan provides you 2 times the benefit as well. Take note, the section in green represents your pharmacy benefit. Please be aware your GAP plan does not cover your copayments for pharmacy. I mentioned we would come back to your pharmacy benefits, so let's take a look at that now. Most of the medications you'll be prescribed will fall into the no more than $15 category. However, this health plan has a no more than $25 copayment for Tier 2 drugs, a no more than $65 copayment for Tier 3, no more than $100 for Tier 4, and preferred specialty is $250. Probably the most important thing I can tell you today in this video is to pay attention to your cost when it comes to prescriptions. What I mean by that is, if you are prescribed a medication that costs more than $25, there is very likely a way to get that exact same prescription from the exact same pharmacy for a much lower cost. Most every brand name drug that does not have a generic available for it yet has a copay card or savings card available from the pharmaceutical manufacturer to get your costs down. There are several good consumer resources to find out more, such as GoodRx.com, BlinkHealth.com, and NeedyMeds.com. So the message here is clear. If you are taking a medication that costs more than $15, there is probably a copay card or discount card made available from the pharmaceutical manufacturer. They are easy to locate and easy to use. Just Google the name of the medication followed by copay card or savings card. This can save you a lot of money. I mentioned earlier, this is an amazing health plan that gives you first dollar coverage for major medical, but you do have to monitor it to make sure it's working for you properly. So let's talk about what to watch out for. Number one, be sure to give both of your insurance cards to your healthcare providers every time you use it. Number two, it sounds simple. Just open your mail to monitor your claims process. You will get a paper trail showing exactly how your claims have paid. If you happen to get an unexpected invoice for a balance due, take note if it's been filed with your GAP plan. Just about the only thing that could go wrong would be your healthcare provider could neglect to file the claim for you. They don't mind filing the claim because it is an efficient and fast way for them to be reimbursed. So simply call the number on that invoice, have your GAP plan card handy, and give them that information so they can file the claim. If you have had several claims or a large claim, it's possible that you've exhausted your GAP plan benefit. You can always call the 800 number on your card to confirm benefits and to see if your GAP plan has paid a claim, and check your available balance. If you're still having problems, you can always reach out to me and I'm glad to help. I care about making sure this health plan works as best as possible for you. If you ever have any questions or problems, feel free to reach out to me directly at 205-222-9440. You can email me anytime at rbhinsurance@gmail.com.